Sexually transmitted infections and tuberculosis in ethnic communities in Canada. Etool for healthcare providers, 2015. This e-tool was developed as part of a larger project on hepatitis C and related communicable diseases in high-risk immigrant ethnic communities with a focus on sexually transmitted infections and tuberculosis. This e-tool was designed to help healthcare providers create awareness about STIs and TB in 5 selected communities in Canada and to educate individuals to take appropriate action to prevent the spread of these diseases. This project was undertaken by the Canadian Ethnocultural Council, a non-profit, non-partisan coalition of national ethnocultural organizations in Canada. In this project, 5 immigrant ethnic populations have been identified: Chinese, East Indian, Egyptian, Filipino, and Vietnamese. Why these communities? The selection was based on the following criteria: the percentage of recent immigrants to Canada from these countries, the high prevalence of hepatitis C, 3% or more in the country of origin, the high prevalence of HIV, STIs and TB, and the means of transmission that has occurred or has been reported to occur involving cultural practices in the countries of origin. According to Statistics Canada in 2006, more than 5 million Canadians were born outside the country and approximately 250,000 new immigrants arrive in Canada each year. However, data on immigrant health are limited. In Canada, STIs and TB continue to be significant public health concerns. However, very little information is available on the prevalence of these diseases in the selected ethnic populations. These diseases are preventable, but they have significant health and social impacts on individuals and communities. A major issue in some ethnic communities is the stigma surrounding diseases typically associated with sexual habits and communicable diseases. Individuals who test positive for these diseases may experience shame, isolation, and hopelessness. They may be afraid of being excluded from their communities and may be reluctant to take treatment or precautionary measures. Therefore, it's important to create awareness and provide accurate, baseline information about these diseases in communities so that individuals in high-risk ethnic communities can benefit from early detection and treatment and can work to prevent others from becoming infected. Healthcare providers need the knowledge and the resources related to the diseases to better inform the communities they serve. Sexually transmitted infections. STIs are infections which are passed from one person to another through unprotected sexual contact, by sharing drug use equipment, and from mother to infant. Worldwide, more than 1 million people acquire an STI every day. The occurrence of STIs in Canada has continued to increase, and this is now a major public health concern. STIs caused by bacteria are on the rise among the young Canadians, and they are spreading fast. Among the most common STIs are the human papillomavirus, human immunodeficiency virus, syphilis, gonorrhea, and chlamydia. Syphilis, gonorrhea, and chlamydia are caused by bacteria. They can usually be treated successfully with appropriate medical attention. HIV and HPV are viruses, and although their infections cannot be cured, they can be treated and managed. STIs may lead to male or female infertility, problems in pregnancy, stillborn babies, or cause other diseases in newborn babies. The majority of STIs have no symptoms. Some symptoms that may occur are unusual discharge and bleeding from genital organs, genital ulcers, and abdominal pain. The tests for STIs include visual inspection, blood test, urine test, swab test. STIs can be prevented by practicing safer sex, using condom even when sharing sex toys, using new needle and syringe each time and not sharing other drug use equipment, getting tested regularly. Having an STI can increase the risk of getting another STI. Some STIs increase the risk of getting HIV and transmitting to their partners by approximately 3 times. STIs can be more dangerous when the infected person has HIV because people with HIV have weakened immune systems, and these cases are even more difficult to treat because their immunity is reduced. Getting tested is the only sure way to know your status. STIs and ethnic communities in Canada. Canada draws immigrants from countries where the prevalence of STIs is high. Among them are immigrants from China, the Philippines, Vietnam, and India. According to a 2012 WHO report, in the Western Pacific region that includes, among other countries, China, the Philippines, and Vietnam, the prevalence estimates for 3 of the common STIs, chlamydia, gonorrhea, and syphilis, total 51.66 million. In 2013, in China, the estimated number of cases of gonorrhea was 99,659 and syphilis was 406,772. The majority of syphilis cases are in regions of China that also have a substantial burden of sexually transmitted HIV infection. In the Philippines, since 1991, STI prevalence rates have been increasing among sex workers and pregnant women. Many of the STIs are reportable diseases in the Philippines, yet routine screening is not performed even among high-risk populations because of financial and technical constraints. The National Institute of STIs of the Vietnamese Ministry of Health recorded 202,856 cases of new STIs in Vietnam in 2006. However, the actual number of cases is likely to be higher as many patients went to private doctors and pharmacists who do not report to the Ministry of Health. India records about 30 million cases of individuals with STIs annually, and about 10 million people per year have been treated. The prevalence of bacterial STIs is decreasing because of increasing access to over-the-counter antibiotics. The prevalence of viral STIs is increasing because of a large number of undiagnosed cases, along with a lack of accessible and affordable diagnostic methods and the incurable nature of viral diseases. The actual incidence of STIs in Egypt is not known, except for statistics on HIV. In 2013, 383 new cases of HIV were detected in Egypt, with an increase in the reported incidence rate of 5.16% between 2000 and 2013. HIV and TB co-infection. About 1/3 of the 35.3 million people worldwide who have HIV also have TB infection, and they are about 30% more likely to develop TB disease than individuals who do not have HIV. TB is the leading cause of death among people living with HIV. In 2013, about 360,000 died of HIV-associated TB. TB treatment is available, and treatment options should be discussed with a doctor. What is tuberculosis? TB is an infectious disease caused by a bacterium called Mycobacterium tuberculosis. TB usually affects the lungs, but it can affect other parts of the body, such as lymph nodes, bones, intestines, or brain. TB infection occurs when the bacteria have entered the body, but they are not growing and are inactive. In TB disease, the bacteria become active because the body's immune system cannot stop the germs from growing. The active TB germs begin to grow and cause damage to the body. TB is spread from person to person through the air when someone with TB in the lungs coughs, sings, talks, or sneezes. Some of the symptoms of TB are cough lasting longer than 2 weeks, coughing up blood, fever, chills and night sweats, feeling tired all the time, and unexplained weight loss. BCG is a vaccine for TB. People with TB infection can take a course of preventive TB antibiotics. This is especially important for people who are at a higher risk of developing TB disease. People with TB disease must complete at least 6 months of treatment with a special combination of antibiotics to cure the disease. Drug-resistant TB develops when patients do not take enough of the right medications for a long enough period of time to kill the bacteria. Drug-resistant strains of TB must be treated for a long time, up to 24 months, with additional medications. TB treatment and medication are free in Canada. TB is preventable, treatable, and curable. TB and immigrant ethnic communities. In 2013, according to the World Health Organization, an estimated 9 million people worldwide were sick with TB, and 1.5 million died as a result of TB disease. Worldwide, 360,000 of TB patients were also HIV positive. 56 million TB patients have been successfully treated since 1995. Over the past decade, 80% of immigrants and refugees who have come to Canada each year have originated from countries that have a high incidence of TB. Although foreign-born persons make up approximately 18% of Canada's population, they account for almost 60% of all cases of TB. By far the highest rates of TB are seen in immigrants to Canada from Asia, in particular Vietnam, the Philippines, China, and India. Most TB patients from these countries have not previously been identified as requiring medical surveillance in Canada after arrival. India has the world's highest TB prevalence and the highest number of multi-drug resistant TB patients. India has between 2 to 3 million people infected with TB and about 280,000 deaths due to TB each year. TB and HIV co-infection is common in India. From 1990 to 2012, there was a 51% decline in the prevalence of TB. China has the world's second largest TB prevalence. There are 63,000 new MDR-TB cases along with the 1 million notified new cases of TB each year. TB treatment, prevention, and control in China have improved in recent years, resulting in a significant decline in deaths due to TB. TB is still one of the leading causes of death in the Philippines, with the 9th highest TB incidence in the world. TB prevalence has shown a steady decline in recent years, and the Philippine government hopes to achieve the 50% reduction in TB prevalence and death rates by 2015 compared with the 1990 levels. In Vietnam, TB is the second highest cause of death among infectious diseases. It is the 12th among 22 countries identified by WHO with the highest prevalence of TB. Many TB cases still go undetected. The government has been working with various international agencies to improve detection and treatment of TB. In Egypt, TB is the third greatest killer among infectious diseases. A recent report shows that between 2000 and 2013, there was a decline of approximately 2% in the incidence rate of TB. Stop TB Egypt, initiated by the National TB Program in 2009, organizes awareness-raising campaigns and patient support services. The highest number of multi-drug resistant TB cases are seen in India, China, the Philippines, and Vietnam. Statistical data on STIs and TB for the 5 targeted communities were gathered through an internet search of reports from the home countries and from the World Health Organization. It is possible that some of the reported data may be applicable to the selected populations in Canada. The information gathered was used in developing user-friendly fact sheets on STIs as well as TB for each of the 5 communities. To promote better understanding and greater outreach, the fact sheets were translated into 6 languages: Arabic, Chinese, French, Punjabi, Tagalog, and Vietnamese. They can be viewed on the Hepatitis C portal of the CEC website www.ethnocultural.ca/hepc. This resource was developed for information only. For specific medical concerns, please seek advice from a medical practitioner.